If you have brown patches or discoloration on your face and you are unsure and you feel frustrated in how to treat it, this video is for you. I'm going to review my top 10 skincare ingredients that I like for discoloration or hyperpigmentation. And stay tuned till the end because I'm also going to give you product recommendations as well as a skincare regimen that you can try for discoloration. Welcome to my channel where we talk all about skin, hair, and nails. My name is Dr. Swati Kannan and I am a board-certified dermatologist and a cosmetic dermatologist out here in California. What is hyperpigmentation? Hyperpigmentation is a generic term and it refers to when certain parts of your skin become darker than the rest. This darkening is due to increased production of melanin. Melanin is the name of the protein that makes pigment in our skin and hair. So it is the intensity and the type of melanin that gives our skin and our hair its color. Now, in areas of trauma, inflammation, or sun damage, you can have increased melanin production, which then leads to the clinical picture of hyperpigmentation. If this discoloration is a result of inflammation, then in dermatology, we call that post-inflammatory hyperpigmentation or PIH. So in this video, I'm going to be saying PIH a lot, and that refers to post-inflammatory hyperpigmentation. Often people who get acne get PIH, and that is because acne is an inflammatory condition. But that's why it's really important for acne patients to not pick at your spots, because if you traumatize it even more, it's going to lead to more scarring and PIH. It's also important that if you have any sort of inflammatory condition that's causing PIH, that you don't do anything that causes further irritation. So for example, in one of my previous videos on controversial skincare devices and trends, a lot of acne patients are using derma rollers at home. While derma rollers, like dragging these needles on your skin, causing irritation, and that can definitely lead to more hyperpigmentation. You can also get hyperpigmentation as a result of hormones plus sun exposure. So this is commonly referred to as melasma, and melasma is when you see these kind of reticulated, lacy-like patches of discoloration on your face, like your cheeks, your upper lip, your forehead. Now, I already have 2 videos on melasma that go into detail regarding skincare products for melasma, as well as in-office treatments that I do for melasma. The video that reviews in-office procedures is also helpful for patients who have hyperpigmentation because I use a lot of the similar devices that I use for melasma. I use the same ones for hyperpigmentation, or at least very similar ones for hyperpigmentation. Some people will also refer to their sunspots as hyperpigmentation. The technical term for sunspots is lentiginous. Lentiginous, while they are darker than the rest of your skin, we don't call them PIH or hyperpigmentation because they don't readily respond to some of the skincare ingredients that I'm going to review in this video. Most sunspots will need like a laser treatment or some sort of destructive method to remove them. You can also get hyperpigmentation or discoloration from sun damage that is different from sunspots, and that does respond to some of the ingredients that I'm going to talk about in this video. In addition to hyperpigmentation, which means darker discoloration, you can also get hypopigmentation, which means lighter discoloration. And that hypopigmentation can occur as a result of inflammation or scarring. And those treatments are different. So this video will mainly focus on post-inflammatory hyperpigmentation or PIH, or hyperpigmentation caused by sun exposure but not relating to sunspots. So when we look at ingredients for post-inflammatory hyperpigmentation, they fall into 2 rough categories: skin lighteners and skin brighteners. In general, skin lightening ingredients lighten skin, meaning that they reduce pigment or melanin, and skin brightening ingredients add vibrancy or, make your skin more glowy. I personally don't like to categorize skincare ingredients because you can have a lot of overlap between the two, and I feel like it just kind of becomes more confusing. But if you see those 2 terms, you now know what they mean, but they are often used interchangeably. By the way, if you're finding this video helpful, please hit the subscribe button and share this video with friends and family who also have hyperpigmentation or discoloration. My goal for 2023 is to really grow my YouTube channel, so I'm really thankful to all of you that subscribe and share. The first ingredient that helps with discoloration is Tranexamic acid. And I'm sure by now, almost all of you have heard of Tranexamic acid. This has become incredibly popular, I would say in the last decade, when it comes to skincare products for discoloration. I also love Tranexamic acid for melasma. So in my cosmetic practice, I actually use all forms of Tranexamic acid. So I will use the oral form of Tranexamic acid for really bad PIH and melasma. I then have an IV form of TXA. I don't inject it into your veins, but I use the IV form. I spread it topically on the skin after I do any sort of laser resurfacing procedure because it helps to decrease the pigment reaction from any resurfacing procedure. And then I also have patients use TXA or tranexamic acid. We abbreviate that as TXA. So I also have patients use TXA in their skincare regimen. So in skincare, I tend to to prefer 3 to 5% TXA because anything greater than 5% can lead to irritation. The way TXA helps is by reducing melanin or pigment production. How exactly it does that, we're not really sure, but we do know that it helps. Additionally, it also helps with the vascular or the blood vessel component. So for example, a lot of patients who have melasma not only have brown patches, but we know that there are certain blood vessels underneath contributing to the melasma. So TXA helps with the vascular component. And this is the same for anyone who has acne scars. Often acne scars have a red component and a brown component. So TXA can help with both. We now have newer evidence that shows that TXA is even helpful for rosacea because it helps with the underlying blood vessels. So if you have rosacea and discoloration, TXA is a really great ingredient. By the way, for all of my rosacea and sensitive skin patients, my next video is on specific skincare for your skin type, so stay tuned and subscribe. If any of you want me to make a video about acne scars going more into depth, please let me know by commenting below. I treat a lot of acne scars in my clinic, and so I think it would be really helpful for you guys to know probably what we do for acne scars. Moving on, the second very common ingredient for discoloration is vitamin C, which is really a fan favorite. All skinfluencers and dermatologists, we love vitamin C because it's such a powerful antioxidant, but it's also a very powerful skin brightening agent. For PIH, vitamin C decreases the production of melanin or pigment. In general, PIH areas have more melanin, and so it's not like vitamin C is going to give you these patchy areas of light and dark skin. It's just going to restore your skin to its baseline. If you want to learn more about vitamin C and get specific product recommendations for vitamin C, you have to check out this video that I made earlier. It's very helpful for anyone who wants to learn more about different vitamin C products. The next ingredient for skin discoloration is hydroquinone. Now, hydroquinone is really the GOAT for hyperpigmentation. It's one of the strongest skin lighteners that we have out there. The way it works is that it inhibits or stops the enzyme that makes melanin or pigment. So we call it a tyrosinase inhibitor because tyrosinase is the enzyme that makes melanin. All hydroquinone now in the US is prescription based. So we used to have 2% and even 3% hydroquinone available over the counter. But when I was researching for this video, I couldn't find any more over the counter hydroquinone available. So all of it's prescription based. In my clinic, I'll actually prescribe hydroquinone strength starting at 6%, going all the way up to 12%. And the higher the percentage, the more likely it is to irritate the skin, but also more likely to work. So I will often take a look at your skin type, see how bad your discoloration is, and then give the appropriate strength of hydroquinone that's needed. We also combine hydroquinone with other ingredients. So we use a compounding pharmacy that makes hydroquinone plus kojic acid that I will talk about later. So a lot of these hyperpigmentation ingredients are combined together to really stop the production of pigment. By the way, hydroquinone is not safe in pregnancy, so do not use it in pregnancy. Additionally, for hydroquinone, I usually ask people to apply it to their full face, not just to individual spots. And this is really true for almost all of the skincare ingredients for hyperpigmentation. Unless I say otherwise, I don't want you to spot treat. I want you to use it to the full face. There is a misconception that hydroquinone bleaches the skin, so meaning that it will change your baseline skin color, and this is just not true. Hydroquinone is actually a reversible skin lightener. So if you stop using it, you do get that melanin production back. But overall, what it is doing is just again, restoring your skin to your baseline color. And it's going to make the darker areas become more even toned with the rest of your skin, but it's not going to bleach all of your skin. Now, in addition to irritation, which is a common side effect of hydroquinone, the other issue with hydroquinone is that you can get a rare side effect called ochronosis. I have only seen one case of ochronosis though in the 13 years that I have been practicing dermatology. So I've only seen one case, and this was in a patient who used hydroquinone for 10 years without taking a break. So we know that hydroquinone can cause ochronosis if you use it for prolonged periods of time without taking a break. So the way we recommend it is that you use hydroquinone at nighttime for about 2 to 3 months, and then you take a break for about 1 to 2 months. Now, for melasma patients, melasma is chronic, so they tend to need hydroquinone on and off. So they'll use it for 2-3 months, take a break, restart, take a break. For patients who just have PIH from acne, as long as your underlying inflammation or acne is treated, you're not going to need these prolonged, courses of hydroquinone. So don't be scared of hydroquinone. It's a really great ingredient, and I use it for my discoloration as well. Now, there are certain formulations of hydroquinone that do come with a retinoid and a steroid. This particular formulation is called Triluma, and I personally don't like Triluma because hydroquinone is already irritating irritating, and then you add a retinoid to it. And then yes, they do have a steroid to help with the irritation, but I don't like the concept of using a steroid on your face for prolonged periods of time. So I personally like to use hydroquinone and retinoid separately. I prefer formulations that contain hydroquinone, kojic acid, plus or minus vitamin C in a formulation that's hydrating. There is another misconception that hydroquinone is carcinogenic, meaning that hydroquinone can cause cancer. The studies that initially thought hydroquinone was carcinogenic was based off of using hydroquinone that also contained mercury. So we know that mercury is a well-known carcinogen, and it was the mercury in the hydroquinone product causing cancer, not hydroquinone itself. There was another study that was done in mice where they used incredibly heavy concentrations of hydroquinone in these mice, which then showed kidney cancer. But we have never demonstrated any form of cancer with hydroquinone used in humans. This ingredient has been around for over 5 decades, but there hasn't been any evidence to show that hydroquinone is carcinogenic in humans. So really, don't be afraid of using it. It's a really great ingredient for discoloration. I feel like my hydroquinone rant was really long, so we're gonna move on to the next ingredient for discoloration, and that is niacinamide, which is a form of vitamin B3. So niacinamide is also what we call a skin brightener. Again, I don't like to categorize, but it is one of the more powerful skin brighteners. And it is in a lot of skincare products because it's not only helpful for discoloration, but it's helpful for pore size, skin refinement, acne, rosacea. So it's really in a lot of skincare products that you may not have to use it just separately by itself. But if you do want to use niacinamide, make sure that it's under 5% because anything above 5% can be pretty irritating. The way niacinamide works is that it inhibits the transfer of melanosomes from melanocytes to keratinocytes. And you're like, WTF, what does that mean? So melanocytes are the cells that make melanin or pigment. Keratinocytes are the cells that make up your skin. Right now I'm pinching keratinocytes. The keratinocytes don't really make pigment. The way you see the pigment is because the pigment producing cells basically package all of this pigment and they send the package to the skin cell, and the skin cell accepts it and then says, look at all of my melanin. That's really how pigment is displayed in the skin. And niacinamide basically inhibits those packages of pigment to be sent to the skin cells. So it's not reducing the production of pigment, it's just stopping the package of pigment from going to the skin cells. And you may or may not have wanted to know how niacinamide works, but I feel like a part of my job here is to have a little bit of science behind some of these skincare ingredients. So hopefully you guys do like that part because I know I talk about the science in a lot of my videos. Going back to sending packages of pigment to skin, areas of inflammation. So anytime part of your skin is inflamed, for whatever reason, it wants more of these packages of pigment. And so that's why, again, niacinamide isn't really bleaching your skin, but it's just normalizing the transfer of pigment to the skin cells. The next ingredient for discoloration, or PIH, is azelaic acid. And azelaic acid is actually derived from a type of yeast that also lives on our skin. It's really funny because there is a skin condition called tinea versicolor that you may have heard of, where people will get an overgrowth of yeast called Pitiosporum ovale. And when you get an overgrowth of this yeast, you start getting these light patches of skin. And that's because the yeast is producing azelaic acid, which is then preventing the production of melanin, thus giving you lighter skin patches. Anyway, so we use the same azelaic acid to help with hyperpigmentation on your face. I feel like azelaic acid is one of these underrated skincare ingredients that we really need more love for. It has so many benefits. I mean, it's safe in pregnancy, it's good for rosacea, it's good for sensitive skin, it's good for redness, it doesn't cause that much irritation. It also obviously helps with pigment, it's anti-aging, so it just has so many benefits. And I feel like all of us could probably use a little bit of azelaic acid in our skincare regimen. So like I said before, it basically decreases the production of melanin, thus lightening the skin. Over the counter, you can find azelaic acid as 10% strength, which is fine. We also have prescription azelaic acid called Finacea, and this can be pretty expensive because it's never covered by insurance. But Finacea has strengths of 15 or 20%. By the way, do you have any questions so far about any of these ingredients? If so, please let me know and comment below. The next ingredient for discoloration is Kojic acid, which is again incredibly popular in skincare products. Kojic acid is derived from fermenting certain types of mushrooms or fungi. Kojic acid is similar to vitamin C in that it inhibits the enzyme that makes pigment or melanin. So it decreases the production of melanin. Too much kojic acid, just like vitamin C, just like most skincare ingredients, can cause irritation. So I prefer strengths that are under 6%. Kojic acid is also safe in pregnancy. And in my office, like I said, I combine hydroquinone with kojic acid 3 to 6 96% in our formulations to help with discoloration and melasma. Another ingredient commonly used with kojic acid is arbutin. There are two forms of arbutin, an alpha-arbutin and a beta-arbutin. Beta-arbutin is a plant-derived form of arbutin that comes from blueberries, cranberries, or leaves of pear trees. I feel like it sounds like a Christmas song. Anyway, and then alpha-arbutin is made in a lab, but the two chemicals are very similar. There is some research that shows that alpha-arbutin is better or more effective than beta-arbutin. The way arbutin works is very similar to hydroquinone actually, so we call it a less irritating version of hydroquinone. It isn't as effective as hydroquinone, but it's also not as irritating. Arbutin, kojic acid, tranexamic acid are some of the more common skin lightening agents. Often you'll find kojic acid and arbutin combined with licorice or licorice extract. Licorice extract helps by kind of spreading out the pigment, if that makes sense. So in PIH or in discoloration, which is characterized by darker patches, the pigment is more concentrated because, the skin cells have more of the packages. And so licorice kind of helps to spread those packages out more evenly, evening out your skin tone. The next ingredient for hyperpigmentation is, of course, a retinoid. So retinoids, again, are really the GOAT of anti-aging skincare. So they are helpful for so many issues like pores and acne and wrinkle prevention, aging. The way it helps for discoloration is not by reducing pigment. The way it helps is by increasing cell turnover, meaning it increases how fast the cells at the bottom come to the top and then shut off. And when you shed those skin cells faster, you then reveal brighter, younger, healthier cells. So you kind of get more of that glowing skin look with retinoids. Retinoids can often be irritating for patients, especially if you have sensitive skin or if you've never used retinoids before. So I do have a video on retinoids that teaches you how to implement retinoids into your skincare regimen without irritation and gives you product recommendations. The ninth ingredient, so I can't believe we already talked about 8 ingredients, but the ninth ingredient for hyperpigmentation is alpha-hydroxy acid like glycolic acid, mandelic acid, or lactic acid. For discoloration, there is maybe one paper that states that mandelic acid is better than glycolic acid for discoloration. However, in general, glycolic acid is the strongest alpha-hydroxy acid, especially when it comes to exfoliation, but it's also very helpful for pigment correction. However, usually when you have anything strong, it also means it's irritating. So compared to mandelic or lactic acid, glycolic acid is more irritating. The way alpha-hydroxy acids help with brightening the skin is by sloughing off the dead skin cells faster. When you slough off the dull skin, it reveals brighter skin underneath. Glycolic and mandelic acid also interfere with how melanin is made. So again, they're helping to reduce pigment directly. And glycolic acid also helps to make collagen actually, so it's also very useful for wrinkle prevention. You can actually watch these 2 videos that talk about how to implement an exfoliating acid into your skincare regimen without damaging your skin barrier. And the video also gives you product recommendations for exfoliating acids. Exfoliating acids, like I said before, should really be started slowly because you want to minimize any skin irritation, which can then worsen discoloration. Now let's talk about the fun part, which is product recommendations that combine some of these skincare ingredients that you can use to help with your discoloration. In all honesty, and unlike what I have said before, we kind of just want to dump as many ingredients onto your skin without causing irritation. So we want to combine as many ingredients as possible to decrease the pigment production while minimizing irritation. And usually I don't say this, right? Usually I say, use ingredients slowly and use 1 or 2 at a time so that you can stick to a regimen. And while that does hold true for discoloration as well, if you only use kojic acid or you only use tranexamic acid, you're probably not going to see too many results. You really see results when we combine all of these ingredients, or not all, but as many ingredients as possible to minimize discoloration. But of course, it is a fine line because while we do want to suppress pigment production, we also don't want irritation. So it is a fine line. There is a lot of mixing and matching and really figuring out what your skin can handle. So moving on to product recommendations, Naturium has a multi-bright tranexamic acid treatment. I think that's what it's called. Multi-bright tranexamic acid treatment that has 5% tranexamic acid as well as kojic acid and alpha-arbutin. I think this is one of their newer products because it was just released back in 2022 and it costs about $22. I have not personally tried this one. I have tried their other version, which was the Naturium tranexamic acid, and that contained 5% tranexamic acid, kojic acid, and niacinamide, and is about $20. So I have tried that one and I have liked it and it didn't give me any irritation. And you can use either of these products either in the morning morning or at nighttime or twice a day. May Love has a product called Fade Away Brightening Serum, which is kind of green color. I actually just used this up. I just threw away the bottle. Otherwise, I would have shown it to you for show and tell today. This one contains alpha-arbutin, kojic acid, and licorice root, as well as glutathione. So this one costs about $37. Let's briefly talk about glutathione. So glutathione, I didn't talk about it as one of the main ingredients for lightening. And that's for many reasons. In India and in Philippines and probably several other countries, they do IV glutathione infusions as a skin bleaching treatment. For so many reasons, I am so against depigmenting your skin with glutathione. And that's because it is incredibly risky. You have a risk of kidney failure, liver failure, really, horrendous rashes that can leave scarring or, be even more life-threatening. So for so many reasons, I am against IV glutathione infusions. Now, glutathione in skincare obviously is not going to give you all of those same horrendous effects, but its efficacy in skincare is a little debatable. So we know that glutathione is an antioxidant. So as an antioxidant, it probably does help a little bit with skin discoloration, but I would not use it as one of the main ingredients for skin discoloration. So anyway, though this May Love brightening product is about $37, it does work well. I didn't get any irritation from it. A lot of my patients really like it, and I think it's a really affordable price point. The way you can use this is first use a vitamin C product and then put on the Tranexamic acid from Naturium or this May Love brightening product. Glow Recipe makes a guava vitamin C dark spot treatment serum for $45, and this one contains various forms of vitamin C, ferulic acid, and if you have checked out my previous vitamin C video, you know that vitamin C plus ferulic acid plus vitamin E, that trio is a very powerful combination. So the Glow Recipe does have, vitamin C and ferulic acid. Also contains tranexamic acid as well as a few other fruit extracts, which are antioxidants. So you can definitely try that. Glow Recipe also makes niacinamide dewdrops, which is a niacinamide serum that people really like as well. Paula's Choice has a discoloration repair serum that has 3% tranexamic acid, 5% niacinamide, and 0.5% bakuchiol. Bakuchiol is a plant-based retinol alternative that isn't as irritating as retinol, that has some of the similar benefits as retinol, but of course isn't as effective as retinol. But the nice thing about bakuchiol is that it's safe in pregnancy, and so this is a product that you can definitely use if you get any discoloration in pregnancy. And it costs about $52. The Ordinary, Paula's Choice, and Naturium all make a 10% azelaic acid emulsion, and so you can definitely use this either in the morning or at nighttime. I usually prefer to use azelaic acid at nighttime though, and you can use azelaic acid in combination with retinoids, hydroquinone, or really any of the skincare products that we're talking about today. SkinCeuticals makes a discoloration defense serum that has 3% tranexamic acid, 1% kojic acid, 5% niacinamide, and 5% HEPS, HEPES, which is their enzyme that they use, which helps to exfoliate skin. So it's alpha-hydroxy acid. And it costs about $108, so it's not cheap. I feel like in 2023, all of these skincare products, the prices have definitely gone up. I remember when this discoloration defense serum was $98, and now it's $108. So we definitely have inflation. I like to use the discoloration defense serum usually at nighttime, or you can alternate it with vitamin C serum in the morning. Allies of Skin makes a Mandelic Pigmentation Corrector Serum. It's a nighttime serum that contains mandelic acid, lactic acid, salicylic acid, plus bakuchiol, antioxidants, as well as peptides that all help to brighten the skin. I would not recommend this for pregnancy though, because it does contain salicylic acid, and salicylic acid is category X, so you cannot use it in pregnancy. It's also expensive at $116, but it contains a lot of really great ingredients to help fight pigmentation, and it's good for patients who cannot tolerate a retinoid because it contains a very gentle chemical exfoliants and bakuchiol. Skin Medica makes a Lightera pigment correcting serum at a whopping $160. So it is very expensive, but it contains a powerhouse of ingredients like tranexamic acid, resorcinol, niacinamide, tetrapeptide 30, and phytic acid. So there are some players in here that we didn't mention, such as resorcinol, which is a very powerful antioxidant, and it helps with pigment as well. We don't use resorcinol by itself though, but when it's combined with other pigment fighters like tranexamic acid or niacinamide, it can be very helpful. And tetrapeptide 30 is a multi-peptide complex that helps to fade pigmentation as well. And like I mentioned before, hydroquinone is no longer available over the counter. You do need a prescription, so feel free to see a board-certified dermatologist in your area if you want to get a prescription for hydroquinone, which really works, so well for discoloration. By the way, are there other skincare products that I didn't didn't mention that you have tried. If so, please let me know by commenting below. It helps for me to know what you all are using, what all you have tried, because it's just impossible for me to try every skincare product out there. Now, how would you combine all of these skincare products and skincare ingredients into a regimen for discoloration? If I prescribe you hydroquinone, then this is a regimen I usually recommend to my patients. In the morning, you would clean your face with a gentle cleanser, and then use a vitamin C serum to the whole face. If, by the way, you have sensitive skin or rosacea, then make sure you use a vitamin C serum that's not going to aggravate those conditions. And you can check out my vitamin C video that really gives you product recommendations for those skin types. After you use vitamin C, you can then use a brightening skin serum like the Discoloration Defense Serum from SkinCeuticals, or the May Love Brightening Serum, or the Tranexamic Acid Serum from Naturium. So you use vitamin C serum first, then your brightening serum, followed by a moisturizer and sunscreen. At nighttime, you're gonna wash your face, so clean off all the makeup off your face, and then use the prescription hydroquinone that we usually compound with Kojic Acid. I also occasionally will compound the retinoid with the hydroquinone as well, but this is only if I think your skin is really gonna be able to tolerate it. So use the hydroquinone to your whole face, followed by a moisturizer to the full face. Occasionally, we can alternate the azelaic acid and the hydroquinone, so one day you use azelaic acid, one day you use hydroquinone, or you can use azelaic acid and hydroquinone on the same day. Like I said, it really just kind of depends on your skin type. The combination of products that we use is really dependent on your reasons for hyperpigmentation. So is it acne that's giving you discoloration? Is it another sort of inflammation? It also depends on how sensitive your skin is. So we can't always combine all these ingredients at once. If you have very sensitive skin, I slowly build up the ingredients as tolerated. Now, if you don't have a hydroquinone prescription, what would be your nighttime regimen? So your morning regimen would be very similar to what I just said about, but at nighttime, you can use the brightening serum again. So you can use any of the brightening serums with the tranexamic acid. You can use that twice a day if needed. You can also just use azelaic acid. You can alternate azelaic acid with retinoid, but whatever you do want to you want to put a moisturizer on top. Once you get used to the retinoid, you can then add an exfoliating agent like once a week or twice a week. And my exfoliating video that I recommended before will give you product recommendations. Alternatively, you can alternate retinol with a product that also contains like glycolic acid. For example, the Murad Rapid Correcting Dark Spot Serum contains tranexamic acid and glycolic acid, so you can use retinol one night and the Murad product the second night. This Murad product is about $83, so it's not very cheap, but it's a really great product for discoloration. Or in lieu of the retinoid, you can use a mandelic product from Allies of Skin, which also contains bakuchiol, which is a retinol alternative. So again, lots of different combinations to help with discoloration. And I know all of this mixing and matching can be tough, and so if you have any questions, please let me know and comment below. As you heard, the above regimens do contain sunscreen, and I actually recommend 2 layers of sunscreen in the morning if you have discoloration. So sunscreen is the 10th ingredient or the 10th skincare product to say for your discoloration regimen. None of these ingredients or products matter if you don't wear sunscreen, because sunscreen is really the first step in minimizing discoloration. So like I said, I recommend 2 layers of sunscreen in the morning. The first layer is your untinted sunscreen, and the second layer is your tinted sunscreen. For untinted sunscreens, I do like the Elta MD UV Clear, which also contains niacinamide, or the Beauty of Joseon sunscreen. This is a Korean sunscreen that has really great UVA protection. For the second layer of sunscreen, I prefer the tinted sunscreen that contains either zinc oxide or titanium dioxide. The tint also contains iron oxide, which protects against visible light or blue light that can also worsen discoloration in some patient populations. So make sure you check out this video next that gives you product recommendations for tinted sunscreens for all shade types. So that is what I have on how to treat hyperpigmentation. Thank you for watching this video, and I will see you in the next one.